The Perinatal Mental Health team at Transformation Partners in Health and Care have created a series of podcasts that focus on perinatal mental health. The perinatal period is usually defined as the time between conceiving a baby and 1 to 2 years after giving birth. We know that during this time, around 1 in every 5 women will experience mental health problems, which may begin in pregnancy, during pregnancy, or in the postnatal period. Perinatal mental health is different for everyone, and people can be affected in many ways. It can often be difficult to recognise the worsening symptoms in the busy days of parenthood. Getting the right help, support, and guidance is vital, but we know that sometimes it can be hard to know where to find it and how to access it. We understand the importance of beginning and continuing conversations around perinatal mental health. By raising awareness of the impact that perinatal mental health problems can have for women, birthing people, and their families, and also showing the effect that the right care can have, we hope that we will be able to reach more people, challenge perceptions, and change attitudes towards accessing help. In this episode, we are going to focus on the role that specialist midwives play in supporting women to get the right perinatal mental health support for their needs. And we're delighted to welcome Laura Bridle, a specialist midwife. Alongside me is also Chelsea. Chelsea is the mother of 2 young girls, a military wife, has worked as a midwife for 3 years, and now works as a lived experience practitioner for Transformation Partners in Health and Care. And me, Meghan Mathieson, Strategic Communications Manager at TPHC, and a mother of a little girl born during the peak of the COVID-19 pandemic. As you listen to our chat today, you may feel you identify and relate to what we're discussing and want to find support. We encourage you to use our website to find support that is local to you. TPHC is not a crisis service, and so in the first instance, we would encourage you to contact your GP, midwife, or local services to support you. So, welcome to Laura. Thank you so much for joining us. I think it would be great if we could start with hearing a little bit about you and how you came to be a specialist midwife.
Sure. Thanks, Megan, for inviting me and Chelsea. So I'm Laura. I'm a midwife, and I've been qualified for 13 years now. I worked as a caseload midwife, so I got to follow women and birthing people from their first pregnancy appointment all the way till about 1 month post-birth. I did that for 5.5 years, and I worked abroad for a little bit, and then came back and finished my master's and went into becoming a specialist mental health midwife, working for an NHS trust in London. And I did that for 5 years and loved it, and have now moved over to the new Maternal Mental Health Service, where I work across a larger spectrum of areas covering South London.
Thanks, Laura. Wow, you've not done anything at all really in those years, have you? It's amazing. And I think thanks for explaining the different roles. And we'll go a bit more into them, because I think most people listening, when we think of midwife, we just think of the one you meet in the hospital that delivers your baby or did your antenatal care. But as we've continued, we know that midwives are best placed to support women and birthing people through these journeys. And we've now moved them into specialist mental health roles. So if you could you just tell us a little bit about the difference between the maternal mental health midwife and the perinatal mental health midwife?
Yeah, of course. So I'll start with perinatal mental health, because that role has been around a lot longer. So a mental health midwife, there should be one in every single trust. And that midwife is there to support women and birthing people, but also staff help facilitate training, because it's odd, when midwives go into their training, they go to university for 3 years, and there might be a day or 2 on mental health. But there's not really that much discussion on it, even though we know from reports and from speaking to women that actually mental health has a huge impact, not just only on pregnancy, but post-birth. And then you're learning to look after this new baby, so how important your mental health is. So when these roles were kind of created and have kind of expanded now, each kind of trust mental health midwife will work slightly differently because they kind of work for the need of their service. For example, the way I worked, we had a larger caseload of women who came from out of area. So that was kind of my focus, was supporting women coming from out of area that were booking at our hospital, and giving them continuity. So I would see them through their whole antenatal period, so from their booking appointment up until the birth, and then being able to signpost them to their postnatal support, because that's so, so important, as we know. And I was also responsible for doing education and training for the midwives and obstetricians and maternity support workers. And I would do that alongside a psychiatrist, a psychologist, because the perinatal mental health teams are so crucial in this. It's really important that we kind of do joined up learning and joined up working together. Also quite nice. I'm sure, Chelsea, you work with these teams, you send referral forms in, but you don't know who they are. So being able to put a face to a name in the training kind of breaks down that barrier. So the midwife or obstetrician could call the psychiatrist and say, oh, I'm a little bit worried about this woman, what should I do? Or this woman's considering this, but she's a bit nervous about being referred to mental health teams, because sometimes there's still a bit of a stigma. So being able to have that kind of joined up working through the training is really, really helpful. I also used to teach water aerobics classes for women with mental health. We used to do art therapy. We used to do signposting. So with mental health, it's a whole spectrum, like most things. Some women might have mild, moderate to severe mental health, and a more severe would be something like bipolar, schizophrenia, severe postnatal depression, post-traumatic stress disorder, eating disorders. There's a whole spectrum of what mental health could be in a more serious context. And those women and birthing people tend to be supported by a specialist perinatal mental health team. And they do tend to get really good support that way, because a perinatal mental health team will have a psychiatrist, psychologist, mental health nurse, and OT that kind of helps social aspect of getting you back into groups and meeting other people, and nurses, which really help with bonding once baby's here. And then there's that other group of women, which is actually the majority of women, who have the more mild to moderate, so the depression, anxiety, low mood, possibly something called tocophobia, which is fear of birth. And those women sometimes kind of slip through the net. So signposting for those women is really helpful, especially through things like third sector. So third sectors like our charity-run organizations like Mindful Mums or Home Start, Pandas, lots of other organizations. And that's kind of where the Maternal Mental Health Service was kind of created, because there was this gap in provision for women, and especially for women in the 4 pathways that the Maternal Mental Health Service focuses on. So they have 4 pathways. There's tocophobia, which is a severe fear of birth, and you can have primary or secondary tocophobia. It's about 14% of the population will have tocophobia. And if it's primary, it means you've never given birth before. So even the idea of becoming pregnant might have been quite scary for you. It might have taken a long time to get to this point. And then the actual thought of birth can be quite terrifying for you. And other women and birthing people might have something called secondary tocophobia, which is where they have given birth before, and that experience of birth has caused them to be extremely fearful for their future pregnancies. So that's one of the pathways for the Maternal Mental Health Service, is supporting those women and birthing people. Another pathway is birth trauma. So if they've had quite an unhelpful experience with their birth, and I'm hesitating and stuttering because birth trauma is like pain. So what a midwife might think a birth trauma is, or what a birth might be as seen as traumatic, isn't always the same for every woman or birthing person. So birth trauma doesn't really have a clear definition, in my opinion. It's kind of just what the woman says it is. I was a home birth midwife for many years, and I've had people who I thought, oh, that was such a lovely, wonderful birth, and they've said, actually, Laura, that was really scary for me. So it's really listening to the woman and birthing person and deciding how they found that birthing experience. And if they've got a more, sorry, go ahead.
No, I was going to say, I think that's a really important point to note across, all of our discussions that we're going to have, and all of the podcasts and topics that may come up, that, what the definition says is different and varies for every woman. And I think you raising that point and mentioning that it's that individual need and that individual experience that you look to and work around is something really important. I think a lot of people will really appreciate knowing that professionals like you are aware of that and understand that levels of all of these issues can vary hugely, and just as you say, like some people would find certain things painful and others wouldn't. It still goes, it links with trauma and other fears and anxiety as well. So I think that's a really important message to say.
Yeah, 100% agree. When I was a nurse first, and when I did my nursing, we were always drilled into our head, pain is whatever the patient says it is.
Yeah.
So I kind of try and remember that with birth. So even though I would think, oh gosh, that was a really traumatic birth, that woman must be really affected, and they're like, no, I'm fine. And so I think it's listening to them, and
Absolutely.
yeah. And although the maternal mental health services are focused for women who have the more severe end of a reaction to that experience at their birth, some more severe PTSD symptoms, that doesn't mean that the maternal mental health service doesn't do anything to kind of help support the other areas. So they kind of do linking with third sector that we talked about at the beginning, about linking with charities and other forms of support, talking therapies. So I think that's important to note, that the maternal mental health service is for the more moderate to severe.
Yeah.
And then the other pathway is for women who've experienced loss, and lost the whole spectrum of loss. So from those women who've had to have a termination for whatever reason, for women who've had early pregnancy loss, stillbirth, neonatal death. Historically, those women, even if they were under a perinatal mental health team, if their pregnancy or baby has sadly died, then they would have been discharged from perinatal mental health team, because the perinatal mental health team holds themselves as like a service to help with bonding relationships. And it was such a really harsh thing for me as a mental health midwife to be supporting someone, and then those services kind of fade away when they've gone through such a traumatic time. So I think it's really crucial that these maternal mental health services are open to those women and birthing people. And some of those maternal mental health services will also be open to partners, because we know the important role that fathers and non-birthing mothers play. They might have found a birth traumatic, they've lost a baby or a pregnancy, so they're not kind of forgotten within the system.
Yeah.
And then the last pathway is for women and birthing people who have children removed due to social care. And this is such an unmet need for such a long time. You can imagine that for whatever reason, these women have had the decision to have their child taken away from them, and they have all this input in pregnancy. They see a midwife, they see a counsellor, they have social services, they have all this input, and then if the baby is separated, then they just lose all of that. It's just all taken away. And we know from reports that those women are the most at risk for severe mental health and crisis. So it's a much, 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 much needed service for those women as well. So yeah, that's kind of how it got developed and how it's slightly different. So it's kind of like filling the gap, mind the gap for the Londoners to try and improve things. Yeah,
that was a really brilliant and detailed overview, and what you explained was such a wide range of therapies and variation in terms of levels of support and care and referrals to other disciplines and healthcare professionals, which I think a lot of people won't know is necessarily available. And these services are relatively new, but exactly as you said, are filling such an unmet need, and doing such important work for so many women who have experienced, as you say, loss or trauma, or have differing levels of anxiety and fear around all of this. And there is more information about all of these, all 4 pathways and the services on our website, which is transformationpartnersinhealthandcare.nhs.uk, if anyone wants more information on that. Chelsea, did you want to come in on that?
Yeah, I did. I'm just digesting everything you said, Laura, because I think you've placed it so nicely, what different midwives can do. And it's really important for even the other healthcare professionals to know where to go and to turn to. But I just love that you really broke it down to what it was like for the women or birthing person experiencing their maternity journey, because I think it's so difficult as a healthcare professional to see the different levels of struggling and the different levels of anxiety and depression, and not always have an appropriate service for people to go to. And, you know, with these new maternal mental health services, they really are trying to meet the broadest range of experiences from the maternity journey. So thank you for breaking those down. Do you want to say a little bit more of kind of what you now do in this new maternal mental health service? So I guess a bit of a day in a life. So I'm a woman and I'm coming to meet you, and you as my midwife in this service. What would it look like?
Yeah, so I feel very privileged because no day is the same. So it's just so enjoyable. I see myself more as a cheerleader almost, and PA because I'm working across 3 big trusts now. And a key part of my role has been ensuring equity. So it doesn't matter where in South London a family might turn up, that they would get the same level of care for their mental health. So I've been working with the specialist mental health midwives in each of those sites, making sure they're full-time, making sure they have access to training for them, because like I said, you know, university, it was like a day or 2. So making sure they have the skills and tools to support women and birthing people well. And a real joy of this job has been working with women and birthing people with lived experience to help shape the service. So the service I work in has been up and running for just over a month. So but we've had lived experience with us from the beginning. So developing the leaflets, how the service should run, making sure that we're going out into the community so other services are aware of us. Because one thing that quite often happens is there's this thought that there's this hard to reach group, but actually services are being harder to reach. And we've been able to work really closely with other services like the pelvic health team, GPs, third sector support, to be able to go into different children's centres, faith groups, to kind of say, this is the service that's starting up, how would it be helpful to run? So that was kind of my job until 5 months ago. And now it's kind of maintaining those relationships and working with the specialist bereavement midwives and mental health midwives, but then also working alongside my team, which are mainly psychologists. And if anyone has ever met a psychologist, they're just wonderful humans. And they're great listeners, which is good. And they are the ones who are offering the therapy to women and birthing people, and that can range from CBT to EMDR to group therapy. Each maternal mental health service works slightly differently. And then I work alongside them. So our focus at the minute for our team, because every maternal mental health service might work slightly differently as we start to evolve, is around loss. So I'm helping work alongside if they're pregnant following a loss, being around for advice and support. We're developing a pregnancy after loss journaling group through art therapy and writing. And I'm also around to help organise things like debrief pathways if that's needed. And I'm around if somebody wants to go back into the hospital, maybe they haven't been back in since their loss. It can be quite nerve-wracking. So just kind of being there for them. And also working along. Sorry, go ahead, Megan.
Sorry, yeah. Can I ask you a little bit more about that? I think, you know, listening to this is absolutely fascinating. All of the aspects of care that are available that you wouldn't necessarily think are within the NHS. And one of them, which I wondered if you could say a little bit more about, was that debrief pathway that you mentioned, and discuss a little bit about that, and perhaps if you've seen more of an increase in that in terms of post-COVID and the effect that the pandemic has had on that, as it, you know, amplified things more?
Yeah, 100%. I was talking to Chelsea about this before, you know, unfortunately with COVID, because of all the restrictions that were put in place, people having to birth on their own, having to go to scans on their own, you know, not being able to be around their family, we definitely saw a huge increase in anxiety, and in, of course, birth trauma. So one of the projects I've been working on in the area where I'm working is to kind of make that easier to find out what support is available for women or birthing person who might want birth debrief. And that kind of looks different depending on where they are, depending on how well they are, because it might be something that a consultant midwife could offer, which is a very senior midwife who specializes in being able to support women through something like birth trauma, to kind of go through their notes, talk about how they felt about it. And then a really great tool for us as healthcare professionals is the consultant midwife, or a professional midwifery advocate sometimes does this role. They can then feed back themes to us as staff within our training about thinking about language, how that felt for that family, and how we can kind of improve the care we're giving. It might be through an obstetrician, and it could also be through the Maternal Mental Health Service, like along psychological therapy.
It sounds like the services are evolving all the time, and the links that you have with women and birthing people to shape the services and meet people's needs it just sounds amazing. Sorry, Chelsea.
No, that's what I was going to say. I said I love, you know, as being a lived experience practitioner, I love when, you know, we're brought in, and if anybody's listening and doesn't, I mean, it's a lot of words for what we do, but is just asking women and birthing people, what was the service like? How do we make it better? What was your experience? And it's great that there's the other side of that as well, because it's, you know, Laura, you'll know this, it's such a negative culture and climate around midwives right now. And this really just goes to show how varied the role is, and how much, you know, they do want to make experiences better. And especially with the roles like the consultant and the PMA, really feeding back those themes, not only from women, but what staff need to do and what they need to be trained in to better support people is, you know, that you can't ask much more from services. And yeah, you're just, everything you're doing sounds amazing. And I know COVID really amplified the climate for midwives working in it. It became a lot harder, but also amplified the negative experiences that women were feeling. And you talked about the need for more kind of birth reflections and breaking down what did happen. Was there anything else? I know you and I have talked a lot about this, that we noticed the increase of intrusive thoughts and what that meant for women, because again, when you break down the experience of birth trauma, it's so different. But I think maternal OCD and just the word intrusive thoughts has a lot of different definitions and spectrums to it.
I think just before you jump in, Laura, I'd say that I think we were having a discussion about this the other day, and intrusive thoughts sounds quite scary, and I think a lot of women would think, oh no, you know, that's not what I've been having, or that you know, it's something similar but not quite that. And this goes back to the point that you were making at the beginning, where women's experiences are very different in terms of pain and how they would perceive something. And I think intrusive thoughts is one of those as well. I don't think that women realize sort of what they necessarily are, or that those things that they're thinking and feeling might be that. And I think it's quite a scary word and phrase to sort of say yes to. Is that, you know, I guess, is that the experience that you've seen from women, as you said, you know, not necessarily wanting to say be referred further, or say yes, I think that's me, or is that what this is this what I'm thinking?
100%. And even in midwifery world, when we first started doing the standalone training about the different diagnosis around mental illness. Maternal OCD, people just think of like, they wash their hands a lot. They don't realize that actually it's much more than that. And then on the flip side, for a woman or birthing person to say to a midwife they might have met once or twice, or might have been seen for the first time postnatally when they haven't slept for a few days, the chance of them opening up to that midwife is really difficult. It's such a brave thing to do, and then so you need that midwife to react well if if you open up like that. So I think that's been really important part of the role of the perinatal mental health midwife and the maternal mental health service is making sure that midwives are equipped to know what those thoughts are, but also supporting women, because we all have intrusive thoughts. You might think when you're walking down the street that, oh, I wonder what would happen if I fell right now, if I jumped in front of that car, what would happen? Then think, why did I think that? And then you just ignore it and carry on. So those are normal, completely normal, weird thoughts that we have. But in pregnancy and postnatally, what can happen is those thoughts can come into our head around the baby. And they can ruminate, so they keep coming back, so you can't let go of those thoughts, and they can become quite terrifying. So, for example, I had someone before who didn't want to leave her house because she was scared that if she went outside, she might step in dog feces and then walk back into her house, and the dog feces would end up on the carpet, and then she could fall over and touch the carpet, and then she could accidentally touch her face and ingest it and then poison her baby. So these thoughts that would just spiral around in her head and make her absolutely terrified, so that she didn't go outside. Other people who would pick their baby up and think, what would happen is if I threw the baby out the window, even though they had no intention at all of doing that, this thought would come in their head, and they would start to think, what is wrong with me? Like, I must be a horrible mother. And they aren't. They are not.
I think as well, those thoughts are thoughts that, if women are having them or birthing people are having them, they don't want to say them out loud. Because it's, again, I think it's one of those issues that isn't talked about very much. And it's quite a hard thing to say to someone, even a midwife. You might not have met them before, and you are sleep deprived, and you're having these thoughts, and you think, I can't possibly say that out loud to someone that I'm thinking that, because what's going to be the reaction, and what is going to be the consequence? But actually, for you and other midwives to say that is completely normal, and you're not alone, I think that is so important for people to hear.
100%. And I think to reassure women, if you are having these thoughts, please do speak to someone, because we can help you to get support. And there's even a dedicated website that was created about 10 years ago called Maternal OCD, which is just full of a wealth of information from women with lived experience. We can go and read their stories and think, oh, I'm not alone. There's not anything wrong with me. I just need a bit of support to get well. And ironically, I was saying to Chelsea, as we were just talking about this, they've just developed a really helpful booklet to celebrate their 10-year anniversary, which has got podcasts on it, stories, where to get help, what kind of help is available if you're having intrusive thoughts. And I guess the big message is don't feel alone. You're not a bad mother, and there is help out there.
And we will link to that and to all the websites that you've mentioned as well.
Great.
Thanks, Meg and Laura. And yeah, totally echoing that. I've, in my own circle of friends, that first conversation of are you having these thoughts is even scary. So I know going to a healthcare professional and saying it, but I was just trying to look up the percentage. I think the link of it says over 90% of women do have these intrusive thoughts, but it definitely, there's a really good quote that I tried to find of, your thoughts are not what you actually want to do. There's really little relationship between your thoughts and your actions. And it's, it's women knowing that if they come to you, it's not an immediate kind of safeguarding red flag or anything. It is just saying these are sometimes normal things that happen while you're pregnant or postnatally. I don't know if you know the actual stats of it, Laura, but it is really high of people that do have intrusive thoughts during the perinatal period. I think it is about 90%.
Yeah, 100%. Yeah, definitely. Because I think even outside of normal life, like,
Yeah.
makes sense. We all have them. It's just that we have the ability to just say at that moment, be like, what was that? I'm ignoring it. Or maybe not even acknowledging it, just carrying on with your life. Like, what was that? I'm ignoring it. So it's the inability where it like keeps coming back, and it affects your sleep, it affects your ability to want to change your baby or hold your baby because you're scared of those thoughts. That's when it becomes problematic, and we want to offer support to help you get better.
And I think that there's many taboos and many myths and many issues that aren't spoken about enough and that people feel ashamed of. And I think this is probably one of the biggest, because, as a first-time mum, I'd never heard about this. I never knew anything about this. It wasn't mentioned. I hadn't heard about it at all. And so I think it's, I think a lot of the understanding comes from women trying to do their own little bit of research at whatever time in the morning, sleep deprived and terrified. And so by having these conversations, and, for both you and Chelsea to say that this is normal, this happens, you might need a little bit of extra support, or you might not, but this is okay. I think that is a massive and really important statement and fact for women and birthing people to be aware of. And I just wonder, for people that are listening that maybe are, knew a little bit about this, didn't know anything about this, sort of what happens next, once you've, I guess, spoken to someone about this, or you want to speak to someone about this, what should you do? Where could you go to get a little bit more help or some support, or just, talk to someone else about it that has been through it and can offer advice?
Yeah, so the website is an excellent resource. It's got loads of links to support and resources, called Maternal OCD. And like I said, we'll link it. But also, you're a midwife. If you don't feel like you can open up to your name midwife, for whatever reason, it's like everything at work. There's always somebody that you don't want to talk to. You can ask to speak to someone else. You could speak to your GP if you have a good relationship with your GP. You can also self-refer to something called talking therapies. It's called something different all around the country. It might be called IAPT, Time to Talk. But if you were to look up IAPT, so IAPT on Google, it'll tell you where your local service is. And that's like a talking therapies type CBT type service. And that's self-referral. So you don't even have to wait to see a GP or midwife. You could refer right away. Being pregnant, you get accelerated to the top of the list. So you should ideally get a phone call and start something like CBT within 4 to 6 weeks, ideally. COVID has impacted the wait list a little bit, but it's not a terribly long wait list. And then if you start to access those services and they realize actually you need something a bit more dedicated and more specialized, like a perinatal psychologist, for example, or maybe if you need a little bit of medication to tie you over until you get well again, then they can refer you to a perinatal mental health team. So it's almost like a safety net. So if you felt like, I couldn't talk to my midwife, or I couldn't talk to my GP, talking therapies, IAPT is a really good first step to try. And like I said, the Maternal OCD's got really good links to helplines and support on there as well if you want to get advice.
I think that's really important to acknowledge that there's different levels for everybody, and in these services, these maternal mental health services, there is a variety and a real range of options and treatments to suit every woman and birthing person out there who might just want a little bit of support or might need a bit more. And the overview that you have given into all of it, I think, will have opened a lot of people's eyes to what is available, because I think sometimes people might think there's a bit of a drop off, post once you've been discharged from your midwife. I'm talking from experience in COVID. You sort of feel like there's a bit of a gap, and you're not really sure who the best person to go to is, or where to get advice and support, but you've really you've highlighted the best ways to do that. So I think that would be really important for a lot of people listening, and just to make others aware that there are services available at all levels across London.
Yeah, and before COVID, there was this great app called the Hoop app, Hoop. Oh my God, it saved my life when I had my son, because I could put in my postcode. It would tell me where there was a baby group on. It would tell me where there was something. I'd put dry shampoo in my hair and I would go, you know, even on the days of like very little sleep, because it's the best thing ever, but it's also the most hard, difficult, isolating thing at times. So
I think we can all agree on that. I think we're all
oh my God,
vigorously.
Definitely.
Yeah. So I feel like we can't all look like Beyonce every day, but you can get out of the house. And I think that's still really important even post-COVID. So there's obviously on your website, you've got really good links to peer support that's available around London. And I think finding the right group for you. So I think one thing I haven't mentioned that's really important, obviously those listening to this can probably understand or speak English, but services are available through interpreters. So if there's anybody that didn't speak English, that wouldn't be a barrier to accessing a maternal mental health service or perinatal mental health service or talking therapies. There's also groups that are more targeted to women. Like in South London, we've got a Spanish-speaking mums group. There's also the motherhood group for Black women. There's lots of different groups that you could find out in your local area that it's helpful to kind of reach out and see, oh, I want to find something that's going to kind of help me get through this joyous but oh my goodness difficult journey of motherhood or parenthood.
I think that's something that kind of we would echo again, is that it's really good to look local and see what is, you know, nearest to you and available to you, because there will be, you know, you just mentioned loads there, you know, there will be those groups out there that aren't far, that you might not even know about, and we will link all of the groups that you said again to this. Chelsea, would you want to add anything to the end of that, or highlight anything else that Laura has mentioned?
Yeah, definitely. I could talk to you both. I mean, motherhood, it brings lots of conversation, doesn't it? But yeah, it is just echoing that. And I think echoing that sometimes when you're sitting there and you know something just isn't right. And you know, some people may say it's tiredness, you just need a nap, it's this or that. But you know, Meg and I have talked about this a lot, that there is this real self-worth to it. Like you really are worth feeling your best. And the hardest part is going to this first step. We hope we provide this with enough support and links and local groups that you do feel comfortable, you know, taking that next step, because you are really worth going to get help. But I absolutely appreciate that overwhelming feeling of that is just one more thing I have to do. But I hope these podcasts and the couple we're going to do really help you know you're not alone. I know we've talked about intrusive thoughts today and just different aspects of perinatal mental illness or not feeling your best, but there's lots of places that you can go and that will make you feel not alone, I guess is my point. And we hope that these podcasts and talking to Laura and other healthcare professionals really show how much support is out there and how much it can be adapted to be exactly what you need. It could be at a very low level or a very high level, but you're definitely just worth it to go get that support.
Definitely. And Laura, if you're, you know, if there's someone listening that thinks, okay, I'm going to do something now, I want to speak to someone a little bit more about this and maybe access some of, you know, the amazing sounding therapies, support, help, offers and guidance are available, what would be their first step? What should they do first?
It depends on where they are in their journey. So if they're pregnant, please speak to your midwife. Almost every trust. I know in England and Wales and Northern Ireland and Scotland, I think we have 160 specialist mental health midwives now, which is incredible, because we definitely didn't have that 7 years ago. So you could ask to speak to a mental health midwife. You could ask to speak to your GP. If you've given birth, speak to your health visitor. Reach out to the IAP talking therapies. Find a local group. There's so many little groups that are going around. Access the website that you guys have created, which is amazing, with all the peer support links there. Yeah, and just, you are not a bad mother. You will get better. And just ask for help.
I think that you are not a bad mother, just ask for help. I think that is a perfect statement to end on, because I think that will really resonate. So Laura, thank you so much for your time and all of your knowledge in explaining the differences in midwives, in services, the support available, and to Chelsea for her knowledge, expertise, and insight. I think, and I hope this will help a lot of women. So thank you very much.
Thank you.
Thank you.